Hello, I'm Dr. DeLuke, and I'd like to tell you a little bit about the DeLuke contoured expander. The expander was designed by me and my staff to fill a need to place more comfortably an appliance on a child's dentition to expand or widen their upper jaw. Previous expanders incorporated metal bands that wrapped around the patient's teeth. The spaces had to be separated between the teeth, which was often an uncomfortable experience for children. The placement of the DeLuke contoured expander requires no separation of the teeth. It begins with either a simple impression of the upper teeth or a non-invasive, non-radiographic scan of the teeth with a 3D scanner. 3D X-ray studies have shown that it has double the effectiveness of actually creating growth in the palate and the upper jaw. The placement of the expander is far simpler with no separators being needed. It places onto the teeth much like a clear aligner or a clear retainer. The only difference is there's a thin coating of adhesive that's painted onto the inside of the expander. Prior to the try-in of the DeLuke contoured expander, the assistant should clean any plaque or food particles with a cotton roll or occasional scaler. The placement of the DeLuke contoured expander begins with the try-in. The try-in is so that the assistant can confirm the fit is proper. When the assistant tries it in, she has to visibly confirm there's no airspace underneath the plastic covering the teeth. Additionally, the plastic must cover all the enamel and be extended fully to the gum line. Prior to mixing this Fuji modified glass ionomer cement, the assistant must rinse and dry the inside of the DeLuke contoured expander. A light spray of air and water followed by a steady spray of air until the inside of the expander has a definite etched and dry appearance. Following this, the Fuji modified glass ionomer cement must be mixed in adherence to the manufacturer's timing for total mixing time and placement. Initially overfill the appliance slightly, and just before placement it is essential to remove all excess adhesive with a brush, leaving only a very thin coating of Fuji on all surfaces. The placement of the expander is far simpler with no separators being needed. It places onto the teeth much like a clear aligner or a clear retainer. The only difference is there's a thin coating of adhesive that's painted onto the inside of the expander. There is no etching prior to placement of the expander, as well as no drying of the teeth necessary. Immediately after placing the DeLuke contour expander onto the patient's teeth, assistants should use a micro sponge applicator to clean excess adhesive at the gum line after fully seating. Once this has been accomplished, light pressure should be maintained on both sides for 3 to 4 minutes. This completes the placement of the DCE, and final instructions for the parents can begin. It's helpful to have a sample DCE to show a parent out of the mouth how to place the activation key into the screw. Before the patient leaves the office, the parent needs to activate the expander under an assistant's supervision at least once or twice. Removal of an expander of this sort is comfortable for patients because the plastic that wraps the sides of the teeth has a flexibility that it's easily stretched, allowing air to get underneath the expander, and with a little jiggle from the side, the expander can be removed. The patients that wear these Sometimes we'll have some gingivitis or swelling of the gums during the 8 or 12 weeks that they have it on, which clears up in a few days after the expander is removed. Our appointment following removal of the expander is called the CRA. We just abbreviated Clean Remaining Adhesive. This appointment is 6 to 8 weeks after the removal or deband appointment of the DCE. This allows for any inflammation or any gingivitis to clear up. So cleaning the remaining adhesive is comfortable for the patient. A hygienist can complete the CRA appointment. She begins with light scaling. Often most adhesive has been brushed off. Any that remains is very easily cleaned off. The broad surfaces of the teeth are most quickly and comfortably cleaned using a high-speed drill with a 169 carbide burr. I do the majority of CRA appointments on the younger patients, age 6 to 9. I want to be certain that it's very brief for them, using a lot of show and tell to create a comfortable and easy experience.